Senator Baldwin.
Thank you, Mr. Chairman. Dr. Redfield, in April, the CDC staff conducted an investigation into a COVID-19 outbreak at a meatpacking plant in South Dakota. Following the investigation, your staff sent a report to the state, that is South Dakota's Department of Health, that included strong safety recommendations the CDC determined were necessary to stem the transmission of COVID-19 at the plant. That report was dated April 21st of this year. Last night it was reported that your office intervened and ordered that the safety recommendations be watered down. The next version of that memo, dated the following day, or April 22nd, essentially adds the words, "if feasible," to those strong safety protocols over and over again throughout the document, telling the plant essentially that these recommendations were voluntary or optional. Workers continued to work shoulder to shoulder at that plant, and the plant ignored the safety guidelines. To date, at least 1,200 workers from that very plant have been infected with COVID-19 virus. 34 have been hospitalized and 4 have died. I will also note that in that same time period in April, on Tuesday, April 24th or 28th, excuse me, that's when President Trump issued his executive order basically naming meatpacking as an essential industry and meatpacking workers as essential workers. I'd like to enter the two documents I referred to, the April 21st and April 22nd safety recommendations concerning this meatpacking plant. If that's okay, Mr. Chair, I'd like unanimous consent to do so. I think I heard somebody indicate that I got unanimous consent. Dr. Redfield, why did your office demand that these recommendations be watered down?
Thank you very much, Senator. I wouldn't characterize it the way that you did. What I would say is that the field teams that we had that were in on the Smithfield plant investigation that you're referring to had a report that they did in the field, and they shared it with the local South Dakota Health Department. One of the critical things that needed to be stressed in that report was that CDC is not a regulatory authority. These were, in fact, recommendations. The Department of Labor and OSHA have regulatory oversight, and their report can direct that regulatory oversight. Our report was recommendations from an EpiAid, and so as that document was reviewed, we wanted to make clarification to make sure people understood ours was a recommendation and not a regulatory requirement.
And I will note that OSHA and the Department of Labor have failed to issue anything but voluntary guidance, as has CDC. There are no pandemic emergency standards in place for workplaces in the US, even though they've had 8 months to work on this. But that's not your responsibility. Did your office have any contact with Smithfield Foods or the US Department of Agriculture or the White House concerning specifically this memo before it was edited?
No, not at that time. There is a multi-interagency discussions between labor, agriculture, and ourselves on a variety of the issues that intersect. But in that regard, again, the purpose was to stress clarity that we were not a regulatory agency. These were recommendations.
Well, given that, I would ask you to consider changing the meatpacking guidance. You could simply say we are not a regulatory agency, but these are the safety protocols that we would recommend and not have if feasible, if feasible, if feasible. It makes it sound like these are not particularly important. If you can do it, great. If you can't, you can say these are our safety recommendations without it being construed as an OSHA standard. And I would ask, will you change that meatpacking guidance in light of the death toll and harm?
I appreciate your comments, Senator.
Thank you, Senator Baldwin.